A central line associated bloodstream infection, or CLABSI, is a localized infection developing within 48 hours of a central line placement. CLABSIs are high-cost infections, and using a Cardinal Health Presource dressing change organizer can help prevent them. Our dressing change organizer can enhance and make more consistent your dressing change procedure, driving improved patient outcomes and lower cost. Cardinal Health offers two types of dressing change organizer kits, a one organizer system and a two organizer system. We offer standard kits and can also create customized kits that align to your hospital's central line dressing change policy. This video will show you our standard two organizer system, where the first organizer is used to remove an old dressing and the second organizer is used to apply a new dressing. Here's how it works. First, place the dressing change organizing kit on a clean, flat surface. Open the sterilization pouch and discard it. Unwrap the contents using aseptic technique. Inside the outer wrapping, you'll see the two inner organizers, a removal kit and an application kit, and also an instruction card. Open the removal organizer using aseptic technique. Once open, you'll see labeled pockets containing everything you need to remove the patient's old dressing. All organizers can be customized, and for the sake of demonstration, 2 masks, gloves, sanitizer, towel, measuring tape, and alcohol swabs are included. Starting from the left, pull out the first mask and put it on. Pull out the second mask and put it on the patient if applicable. From the second pouch, pull out the hand sanitizer and use it for 30 seconds. Alternatively, you can perform hand hygiene. Also from the second pouch, pull out the gloves, unwrap them, and put them on using aseptic technique. From the third pouch, pull out the towel and place it under the patient's arm. Remove the transparent IV line dressing and dispose of it. If the dressing is hard to remove, you can use one of the alcohol wipes from the fourth pouch. Remove the antimicrobial dressing and dispose if applicable. Remove the securement device if applicable and dispose of it. If there is any debris on the skin, use another alcohol wipe from the fourth pouch to clean it off. The measuring tape from the third pouch can be used to measure external length of the catheter and/or arm circumference. Dispose all removal trash. Dispose of your gloves. Now we're ready to use the application organizer. Open the application organizer using aseptic technique. Inside the fold, you'll see a pair of gloves and hand sanitizer. Continue opening the application organizer. Once open, use hand sanitizer for 30 seconds. Don the gloves. You'll see 3 pouches containing everything you need to apply a new dressing: a CHG prep stick, skin protectant, gauze, antimicrobial disc, a transparent dressing, and tape. From the first pouch, remove the CHG prep stick. Prep the skin starting at the insertion site and working outward in a circular motion. There are 4x4 gauze available in the second pouch you can use if you wish to hold and lift the line while prepping. Apply the skin protectant from the first pouch, if applicable, and allow to dry. Open the antimicrobial disc from the second pouch and apply to insertion site. Now would be the time to apply a new securement device, if applicable. Apply transparent dressing from the third pouch. There are also tape strips included for additional securement with the final dressing, or to stabilize the line during the dressing change, if applicable. Label dressing with date and initials according to your facility's protocols. Dispose of all application trash. Remove and dispose of the patient's mask, if applicable. Remove and dispose of your gloves and perform hand hygiene. Cardinal Health offers standard and customized dressing change organizer kits to support your initiatives to reduce CLABSIs. Our solution is designed to help protect the sterile field, centralize products needed for dressing changes, and empower you to drive dressing change compliance. For more information, contact your Cardinal Health sales representative or visit the Presource Surgical Packs website.